Mr. Speaker.
Order. Questions for oral answer. Mr. Yip Hon Wing.
Sir, the Pfizer BioNTech COVID-19 vaccine is currently approved for use in individuals aged above 5 years. The use of the vaccine for younger children is still being studied in clinical trials. MOH, in consultation with the Expert Committee on COVID-19 Vaccination, the EC19V, continues to examine different vaccine strategies based on the risk-benefit assessment to the relevant subpopulation in the context of the evolving COVID-19 situation. Thank you, sir.
Mr. Yip Hon Wing.
Thank you, Mr. Speaker. I thank the SMS for his reply. What is the infection rate of children under 5 years old in Singapore? There's a new study that suggests that the Pfizer vaccine is less effective for children. Is the ministry looking into other vaccines like Johnson & Johnson or non-mRNA vaccines like Sinovac or Novavax for approval for use in children below 5? What more should parents of children below 5 years old do to prevent them from getting COVID, since there's currently no vaccination? Thank you.
So the member asked 3 questions. For the first, the specific data is a slightly different issue from what the PQ he filed. I suggest he file a PQ, potentially a written PQ for that data. We'll get it to him. For the second question about other vaccines, we are studying all the clinical data that's being produced for all the therapeutic inventions, for all the therapeutic interventions for COVID-19. We'll take that data, we'll take the recommendations from our professionals and our experts, and we'll assess the various products as they become available for licensing here in Singapore. In terms of what parents can do, well, hygiene continues to be important, and making sure that we stay at home if we're feeling unwell, engage with the testing procedures, the various protocols that we have explained for our community, protocols 1, 2, and 3. These are not just for ourselves, they are for our family, for our loved ones, and for society at large. And if we can all play our part in helping, then the youngest, the most vulnerable, all vulnerable members of our society will be better protected. Thank you, sir.
Mr. Leon Pereira.
Speaker,
Leader of Opposition.
Thank you, Mr. Speaker. Just a quick question for the SMS. This is with regard to the study that was being referred to by Honourable Member Yip. Has that changed the consideration of the expert committee and the ministry as to the effectiveness of vaccination amongst children, especially those from 5 to 12? What is the ministry? How is the ministry responding to that study? And is the ministry undertaking its own independent study in Singapore as to the effectiveness of the vaccine for children above the ages of 12? Thank you.
So I thank the member for the question. The issue is not whether a vaccine is or is not effective. There is a matter of timing, of dose, and the circumstances. So the matter continues to be studied by various people around the world, as well as our experts here. For children, the age groups that he mentioned where the vaccine is already being rolled out, indeed we continue through our various public health processes to monitor and measure the effectiveness of the vaccination process.